Are you curious to know how PTAs treat MCL sprains? Well, you're in the right place. In this video, we'll cover everything you need to know about MCL sprains and how to treat them. From the causes, to the symptoms, to the best treatment options, we'll leave no stone unturned. So sit back, relax, and let's study MCL sprains together. Hey everyone, and welcome to another video. To start off, let's delve into the structure and function of the MCL. This ligament links the inner part of the femur to the inner part of the tibia. Its primary role is to provide stability to the inner knee against sideways forces. It also aids in stabilizing the lateral rotation of the tibia during knee flexion. Switching gears to the causes of MCL injuries, athletes who participate in contact sports or have high agility are more prone to suffer from an MCL injury, especially those who play football or hockey, where they have a greater risk of receiving an outside blow to the knee. MCL sprains can range from a grade 1 to 3, with the involvement of other structures known as the terrible triad injury, which we can get into another time. Let's go over the level severities for sprains. Grade 1 is the least severe, where there's a slight stretch with minor ligament damage. Grade 2 is the ligament fibers being partially torn, causing a noticeable laxity in the joint. Grade 3 is the most severe, with a complete tear of the ligament. When speaking of our MCL grade 2 sprain, this can lead to pain and difficulty fully extending and flexing the knee. Other symptoms may include strength deficits, potential loss of proprioception, and antalgic gait. The partial tear may also lead to some laxity in valgus testing due to the supporting structures being damaged. Initial treatments include the RICE method, so rest, ice, compress, and elevate, and medications like acetaminophen or NSAIDs for pain control. The patient may also utilize a hinge brace or knee immobilizer initially to reduce weight bearing. Physical therapy goals include increasing range of motion, starting light resistive exercises, and pain management. This can include activities like heel slides, stationary bicycles, and quad strengthening exercises. Be sure to incorporate functional activities as well, such as squatting and stair climbing. Pain management can be done through ice and electrical stimulation, while transverse friction can be used to avoid adherence to surrounding structures. Extra care should be taken around the proximal attachment to avoid bony periosteal disruption though. Patient outcomes typically are that they recover within 4 to 8 weeks, as long as there's no severe damage to the other structures like the terrible triad that we were talking about earlier. And that just about wraps it up for our MCL sprain grade 2. Have you treated a patient with an MCL sprain? Any tips to help study and remember when treating? Leave them down in the comments below. We also have a podcast where we release 2 episodes a week. Be sure to check out our links in the description below for that. And until then, we'll catch you in the next episode.